My name is Vicky Downing. I'm an educational psychologist. I work in private practice in Boksburg and Benoni. My work involves working with children, teenagers, adolescents, adults. I do assessments, I do therapy, I also do psycholegal work, and I also work with university students. I think since COVID, there's definitely an increased awareness about the importance of good mental health care. Although there is still some stigma, particularly around people accessing services. I know often by the time somebody comes to my door, they have tried everything else available, and often they don't even tell their friends and family that they are going to see a psychologist because of the stigma surrounding it. I think some students are aware of the different services that are available at the universities, but I think overall it is very under-resourced. I know that there are waiting lists as well for many students to receive the help that they need. Also, many communities are very under-resourced. Only a few people are able to actually access private healthcare. I think we're all very well aware of NHI and what that's for, how that plans to address the issues if it's implemented properly. Also, unfortunately, in our country, we do have poor implementation of policies. We have the most wonderful policies regarding healthcare provision and mental health care provision, but the implementation is where things go wrong, unfortunately. There's also a limited number of practitioners out there. If you compare our stats in terms of our psychiatrists, allied health workers, psychologists, registered counsellors and so on, compared to other lower and middle income countries, we definitely are lacking, and you can't even compare us to your higher income countries because we are definitely very, very under-resourced in terms of our human resources. And we are also very well aware of the overburdened healthcare and in the States. There's definitely a lot more young people who suffer from anxiety, particularly social anxiety, PTSD, and then also your disruptive behaviors like eating disorders, your ADHD and so on. In the past, particularly your anxiety disorders weren't as prevalent as they are today. Also, things like ADHD are a lot more commonly diagnosed, and I think a lot of it has to do with awareness. Also social media, the influence that people are, putting on social media, their problems and their issues. So definitely it has become a lot more widespread. And I do definitely find high levels of anxiety with young people. I was actually reading up some stats recently, and they say that approximately 20% of young people, that's your adolescents, your university students, can present with anxiety disorder. So it is very high prevalence rates. If you think that's 1 out of every 5 people, that is a lot. Also, you do find an increase in substance abuse disorders, suicidal ideation, depression. I know I see a lot of that in my practice, unfortunately. Anxiety definitely is the most common one. Previously, there were high levels of anxiety. I think unfortunately it does come part and parcel with our country and what we've been through as a country in terms of our history. But I think nowadays it is a lot worse. And a lot of it has to do with the increased pressures that our young people face. For example, academic performance, that's always been there, but I think nowadays it is a lot worse because there's a lot more people battle financially. You just have to think how many students can't afford to go to varsity or can't afford to stay at varsity because of the financial pressures that they're under. Social issues like violence, gender-based violence as well. Employment opportunities, post-training, that's definitely something that is a lot more stress invoking for our young people than definitely when I was at varsity. Particularly looking at your healthcare, your doctors in training and your healthcare students and your allied healthcare, even the anxiety around placement and internship and ComServe sites, that can also make things a lot more stressful for our young students. And then also the possibility of immigrating and everything that goes around that, because even though that is an opportunity, it can place a lot of stress on the student while they are studying in terms of looking into where they could possibly go, where's their qualification going to be recognized, do they want to have to do additional training or need to do extra practical hours. So that is definitely something that can make things more stressful. Unfortunately, mental health care issues are often not recognized as real problems by the community because often only real problems come with things that you can see. like a broken leg or a bruise or a sprain or something like that. And unfortunately, with many of the psychological conditions, you don't see the physical until it does get to a stage where it's totally unmanageable as well. So a lot of the stigma comes from it not being recognized because you just can't see it. And also, there's also the idea that you can get over some of your psychological issues if you're anxious, or just get over it. You'll be fine. Talk to a friend tomorrow morning, you'll feel much better. Tomorrow's a new day, you can get on with it. So a lot of that thinking isn't very helpful at all, and does just add to the stigma as well. Sometimes people are also labelled and they're told, the child is just lazy, or they have a difficult temperament, or they're attention seeking, or they're naughty, or the young person is just a worrywart, but they'll be fine. So those labels also don't help. And a lot of it again has to do with the fact that you can't see the physical symptoms as well. So because of them not being recognized and stigmatized, the person doesn't get help that they might need to have the best chance possible to have a good life as well. And also, unfortunately, many of the vulnerable communities are under-resourced to change those perceptions. So even if people in the community do want to change the perceptions, we do need a will, and we do need a lot of resources to go in and educate and let people know that actually there are things like anxiety, there are things like depression. It's not just somebody who's too lazy to get out of bed in the morning. If you have chronic depression, even brushing your teeth can be a very challenging task. It can take an enormous amount of energy out of you, and it's not something that's visible like a broken bone, but because we don't see what's happening on a neurological level in the person's brain with a lack of serotonin, which you can't see with the naked eye, unfortunately, it does add to that stigma, and people just don't understand it. Regarding students and healthcare workers accessing treatment, I think since COVID, as I mentioned earlier, a lot of that has improved because people have realized that this is a real problem. Again, I'm thinking of the Healthcare Workers Network, which was started by a psychiatrist during COVID when she noticed there was a need, and a lot of the healthcare workers on the front line were really, really battling. So I think having those different systems in place are fantastic in terms of reducing the stigma, because then people can reach out and say that it's okay, I can ask for help. There are people who do listen, and there are people who do care, and there are people who realize just how incredibly stressful our jobs are and the amount of responsibility that comes with it. But having said that, I think also, unfortunately, healthcare workers are often held to a higher standard by general society, and it does also make it then a little bit more difficult for them to access healthcare services, because they're doctors, they're meant to be perfect in society's eyes, and unfortunately, it's almost seen a case of, well, a doctor can't have anxiety and they wouldn't make a good doctor, when we know in actual fact many doctors do have anxiety, and because of that they end up being fantastic doctors because they don't want to make a mistake. And who doesn't want to go to a doctor who doesn't want to make a mistake? But it's more a case of just that perception from the larger community that because you're a doctor, you're not allowed to have anything wrong with you, and we know that that is definitely not true, and it's not fair for our healthcare workers and our young doctors. The interdisciplinary teams provide collaborative care, so what that entails is then each practitioner brings along their own set of skills and then focuses on a different area of the person's functioning. And then working together, you do have a holistic approach, taking into account all of the different difficulties that the patient may be having, as well as being aware of strengths in some of the areas. So obviously you can use the strengths then to compensate for some of the difficulties. It is very important that there is good communication among the different members of the interdisciplinary team, and they can work incredibly effectively then to ensure the best outcome possible for the patients. It is very important that they do share details, obviously, of relevant information regarding the treatment processes, so that everybody ends up working together and on the same page, enable to help the patients. I do think it is easier in a clinic or a hospital setting, just because of the proximity that they are there working together. It's a lot easier for them to share case notes, or to discuss their patient's details, or to discuss the treatments or things that they've noticed with the patient. I think in private practice it can be a bit more challenging, and it does take a bit more effort, but it definitely can be done. And as we know, working together as a team does lead to better prognosis for the patients. So it is definitely something worthwhile pursuing. I do think there's definitely an improved awareness of good mental health, the importance of it. Also, in terms of self-care, people are definitely a lot more aware of alternative therapies that they can use, even engaging in things like yoga, for example. So I do think there is a huge improvement there. I think also because of COVID, again, it did make people very aware of how mental health can affect a person's overall well-being, and I think many people experienced that for themselves during COVID. Being isolated from friends or family, having to work from home on their own a lot of the time. So I think it definitely did allow a lot more understanding from people. I think also people are nowadays more willing to ask for help. I know I've seen that in my practice. Some years ago, you wouldn't have that many men coming to ask for help, for example, and now it's very common to have a young man come and book an appointment because he's battling. And I think that's fantastic if people can acknowledge that we all have emotions and sometimes we all need a bit of help. So that is definitely improved. I know some organizations and universities are also a lot more aware of the importance of good mental health, and they offer different conferences or wellness days. I know, for example, UCT is hosting a Wellbeing and Flourishing conference in September for their students. I saw an email today to that effect, coincidentally. So I think, people are definitely a lot more aware of it. And once we're aware of it, we can put support systems in place so that people can go on and be productive, be successful, and be happy. And who wouldn't want a happy student who does well? So definitely a very positive trend that we see. In terms of technologies that offer hope, I think also, again, because of COVID, I know COVID was very devastating for us, but it did bring a lot of positive things, and one of them was online therapy. So a lot more psychologists and counsellors started offering online therapy, which makes therapy then a lot more accessible, because you don't have to be in the same geographic location or within a 20 or 30 minute drive or taxi drive to get to your psychologist or your counsellor. So that online therapy has definitely opened a lot of doors as well. WhatsApp counselling is also something that some organisations, I know for example SADAG offers that, again making it a lot more accessible. Data costs are a lot lower. Teletherapy also making it accessible, so even telephone call therapy can also be very useful, and that also makes it easier then to access help after hours. I know many of SADAG's support groups run 24/7, so that also makes it accessible then, even if you can't go during the day because you're in lectures, you could have a call with someone in the evening. So that definitely does offer a lot of hope. There's also been an increase in pro bono service provision, and I'm thinking about a different organisation like the Healthcare Workers Network, where they did put different psychologists or counsellors in touch with nurses during COVID and doctors during COVID to get that extra support. So that has been wonderful. And then also just looking ahead in South Africa, we have something called the National Mental Health Policy Framework and Strategic Plan, which has some fantastic ideas there. But again, as I said earlier, we need to implement them. So if they are implemented, I do think that will also bring a lot of hope. I think it's okay for students to realise that it is okay to ask for help. I think that's first and foremost. There's nothing wrong with asking for help. I think it's generally quite a human thing. We all go through tough times, we all go through easy times, and it's okay to realise in those tough times that we can ask for help. Make use of the supports that the universities have in place, because that's exactly why they're there. Nothing wrong with going for a couple of counseling sessions if that's what you need, or someone helping with time management or studying strategies. So that is very, very useful to be able to make use of that services. Don't be afraid to use technology, as I mentioned, the online therapy, the support groups that one can join, and also to look after your own mental health through engaging. Again, you want to look holistically, you want to create some kind of balance, looking after your physical health as far as possible, trying to get some exercise. Even if walking to lectures, that's exercise, you're still walking around, that's very helpful. Trying to get as much sleep as you can. Again, as in the real world, I know that there's a lot of the students do have demanding studying timetables, but try and get sleep then when you are able to. Try have a calming bedtime routine that could also just make that sleep a little bit more effective. Looking at eating healthily as much as you can. Again, looking after your physical health can also have a bearing on your mental health. Focus on what you can control in the different situations, because often everything feels very much out of control, but there's always something you can control. And then try and practice self-care routines, things like making sure you are trying to do some deep breathing exercises, for example, something easy you can do while you're waiting for a lecture to begin. Also looking at things like mindfulness, again, something you can practice at any time before a test or exam is a wonderful time to do that. It increases the oxygen flow to your brain, you focus better, you remember your work better, and you feel calmer. So knowing those strategies, having them on hand, and then using them when you need to, and not just during tests, but also make it part of your daily practice. Even if it's 2 minutes mindfulness daily, even before going to bed, it will help you fall asleep better, and it is also very good for you in terms of lowering anxiety levels. That mental health conditions are real. Even if you can't see them physically, they are very real, because they happen a lot of the times in the brain, other parts. So just that pure recognition that they are real, and then encouraging people to talk about how they're feeling and being okay with it. I think years ago, if you think about how many of our cultural groups lived, we were very much in the sense of community, and we spoke with each other. And nowadays we tend to live very much in isolation. And I think that's also why we are seeing a lot more mental health struggles with people, because we don't have that group sense that we used to have before, whether it's in a group with extended family, our small immediate family. We do tend to live past each other these days in many instances. So I think those two things, recognizing the reality of mental health care and encouraging people to talk without feeling judged, can go a long way towards making a difference.